Hey everybody, Phil Gorman here, posture expert. Welcome to Today with Michael Cohen. Michael Cohen, chiropractor, acupuncturist, and creator of the Acuball. Thank you, Michael, for taking the time out to speak to me today.
My pleasure, Phil.
So in my practice, I use this little guy here a lot to help people activate their spines, to bring awareness and bring about some life to their feet. And I also have a lot of people, a lot of women who are pregnant, and they use this Acuball very successfully. So Michael, I was wondering if you could speak to women and the posture issues around pregnancy and how the Acuball impacts them.
Sure. As you know, the pelvis mechanics completely shift as the fetus develops and the hips widen and anterior displacement occurs. So that causes a lot of pain, especially in the sacroiliac joint, lumbar dysfunction. So we try to get, before the fetus has developed a lot, the patient into using the Acuball on a daily or bi-daily basis, just to run right through their spine and especially go on the anterior aspect of the pelvis. So right on the symphysis pubis.
Oh wow, okay.
Yeah,
great.
Right there, just to help to open up the pelvis. And then as the pregnancy develops and that's no longer possible to lie in the front, then we shift to side posture and back posture. And we're working the glute muscles, either side of the sacrum, right on the sacrum, and we always get them to use the Acuball on their feet as well, the Acuball, maybe the smaller one. And it seems to make quite a difference for them. A lot of my patients will say, like, I don't go anywhere without that ball.
Right. I certainly see that in my practice too, that women are so thankful for this device. They're like, this is the only thing I can use. This is kind of my, if you want to call it drug, this is my thing that I can consume that helps me with my pain and my dysfunction.
So your patients are consuming them?
Yes.
What are you telling them, Phil? No, I'm just kidding. No, but it is a good thing, and it's so easy and it's so natural. And like you said originally, it makes them more connected to their body, which is the key, isn't it?
Yep.
Being aware, and then you feel it and sense it, and then you can respond to it. So yeah, that's mainly the way I use it with pregnant patients. And then of course after the birth, they're using it. And even there is a group here in Ontario, the Women's Pelvic Health Organization, and they use them all the way through, including in the delivery room.
Wow.
Underneath the sacrum.
Cool.
Yeah, and for the pelvic floor, they do a lot of work on pelvic floor release. And so they're using it in all those different ways, and it seems to really be helpful.
Excellent. Well, thanks, Michael. If you are pregnant or thinking about being pregnant at some time in the future, I would highly recommend this device. Thanks very much. Have an amazing day. Thank you, Michael.
My pleasure.
Right on.